Hey, if you didn't realize that Medicare is making major changes for 2026 and 2027, and what if in 2026 you are not aware that you're actually losing your drug coverage, losing medication on your formulary, you're losing your plan coverage, you also may be increasing bills that are just kind of silently there. You don't understand how Medicare Part A and Part B services have changed, and you're going to be in 2026 holding kind of the bag on these major changes. Stay tuned. I'm going to walk you through exactly what's going on and the 5 major things that are important for you to know. So the first major thing, this year in 2025, the max or true out-of-pocket cost for medication is capped at $2,000. Going into 2026 and probably going into 2027, we're going to see some additional changes. But 2026, one of the things you need to understand is the max is $2,100. Now, what has happened in 2026 that's so catastrophic and so frustrating and confusing for most seniors? We just talked to hundreds and gotten thousands and thousands of calls coming and going out of our office through the October, November, December time period. A lot of people are confused about this thing. I want to walk you through exactly what's happening with this item, and that is Part D deductible. So most Medicare Advantage plans have administered or added a Part D deductible. Now, why did they do that? Well, the rule going into 2026, they've raised the true out-of-pocket cost, which means the max amount that you would pay out of your pocket is up to $2,100. But that is based on the retail value of the medication. So there's going to be a retail value column that your medication is going to cost, and they take 25% of that each month and they allocate it towards the $2,100 max. So you actually could be paying copay cost of $0, $4, and maybe $47 on 2 drugs. And your copay cost is what, $94 each month to get those medications filled. But the retail value of those drugs could be, $2,000, and 25% of that is $500 that's actually going towards your max out of pocket of $2,100. So what does that mean? That basically means in about 4 months, your cost of medications, you would go through the deductible stage, which I'm going to cover with you. The initial coverage, which is what your copay amounts are, and typically they're 5-tier or 6-tier drugs, or a 5-tier drug plan with a selective tier for like maintenance medications. Maybe you're on a plan that has selective drugs covered and it's a $0 copay or a $10 copay for certain drugs that maybe are for chronic illnesses or certain diagnoses. But the initial coverage, and then to come out of the initial coverage and go into the catastrophic, you have to hit that $2,100 max or true out-of-pocket cost. And then you go into the catastrophic. If you hit the catastrophic, you have 0 cost. So in years prior, you would have had a percentage amount. The last percentage amount was 5% of the medication cost, but now that's been eliminated. So if you're on medications maybe 4 years ago, haven't been on medications, going back on medications and going into 2021, I want to make sure you understand this huge difference with deductibles and explain that to you here in just a second. So the drug deductible for Medicare Advantage for most areas that we work in, which is about 15 different states, 20 different states that we have clients in, and we help anybody across the US, but those are the main states that we actually have our clients in. We've noticed that most Medicare Advantage plans going into 2026 have a Part D deductible. Now, it's going to typically range anywhere from about $200 to $600 or $625 for the deductible. So what does that mean? That means that at the beginning of the drug year, January, February, March, if you are on a Tier 3, Tier 4, or Tier 5 drug, that's like a name brand, non-preferred, or specialty tier, you're going to be subject to that plan's Part D deductible. Tier 1 and Tier 2 drugs are typically generic, are excluded from the deductible. Now, understand this is a caveat, and really it's not a caveat that's a plus for you, but some medications that are on Tier 1 and Tier 2 in previous years now have been changed to a Tier 3 level. So you have a generic drug that's been placed at a Tier 3 level because the medication cost is high on that generic, and drug plans are trying to recoup how much money they're going to pay out for coverage. This is all Medicare Advantage, all prescription drug plans. So they've done a couple of things. Prescription drug plans, we've seen suppression of going from about 35 different companies down to 7 companies with about 2 plan options, so about 14 plans, when prior years there was over 100 plan options for drug coverage. If you are in a situation where you didn't change your plan for drug coverage and you didn't realize your drug plan is coming off the market, You either A, could be auto-assigned into another drug plan. If you have LIS or Medicaid and some different rules, you can be auto-assigned or rolled into or transitioned or crosswalked into a drug plan. Or you're going to wake up January, go get your medication filled, and you're going to hand them your drug card and realize you have no drug benefit. So if you did not review your options, I would encourage you, based on a special enrollment period that Medicare has in place for right now until the end of February of 2026, you actually can still, using this 63-day loss of credible coverage for drug benefit, you can actually still enroll into a drug plan or a Medicare Advantage plan with a drug benefit. So that's very important for you to remember how the drug deductible works. You're going to be meeting that deductible in Tier 3, Tier 4, Tier 5. And then you'll begin to pay your copay costs going through the initial coverage, which is the second stage, until you reach the true out-of-pocket costs, and then you would go into the catastrophic. But making sure that you don't mess up your drug plan based on your Medicare Advantage plan being taken out of the market, or your prescription drug plan with a Medicare supplement or original Medicare leaving the market and you being unaware. Stick around, I'm going to go over the next point. The third point, some drugs have negotiated prices now. So actually what we've seen is name brand drugs, actually some of those are being negotiated with the health plan negotiating price with the pharmaceutical company, because now the health plans are having to allocate up to 65% of the cost of the drug. Once they get into a certain stage, which is a catastrophic stage, they're having to pay a portion of that, and the pharmaceutical company is having to, in a sense, buy down. Now, the politics I won't get into, but the reality is that some of these plans have negotiated pricing and it's lowered the cost of the drug. So what does that mean for you? Well, one, you don't get into the catastrophic as soon if a drug went from $2,000 down to $1,000, and $1,000 times 25% based on the retail value, $250 goes towards your max out of pocket. At a $2,000 retail cost, at 25, it's $500, and you get into the catastrophic stage. So why did they negotiate this? Well, guess what? They leave you holding the bag for a longer period of time throughout the year, paying co-pays or cost insurance or co-insurance amount, and getting you to the catastrophic later into the year. So how do they do that? One, they add a deductible. It extends out the amount of money you pay. It extends out the time at which they would actually have to start consuming the cost of that medication. And two, some drug plans and drug benefits or drug coverage, the formulary that's on the drug that's on that formulary has been negotiated. Some have not. And so it just depends on that drug plan, whether or not you're getting a better deal. Just because you're on a great Medicare Advantage plan that covers your doctors, your specialists, and the copay costs are great, you need to be looking and being aware of how the drug benefit works. We've seen people that have gone from $200 or $300 up to $2,000 of out-of-pocket costs, and they could have just changed their plan, and the copays on those two different Medicare Advantage carriers were about the same, and they covered the doctors and the specialists and all those things that are checklists of things that we look at, but the drugs can be drastically different based on, again, the deductibles and the negotiated price, and we're going to go on to the next point. So number 4 is what we call dual SNP benefit delays, or delays in changes of the dual eligible population. So if you're on a fixed and low income and you qualify for a state Medicaid, your state, some of the rules and regulations have changed. They're aligning plans. So if the MCO carrier, the Medicaid carrier organization in your state has a contract with Medicaid, then if you're enrolling into a Medicare Advantage plan, you can only enroll into a Medicare Advantage plan that aligns with your MCO carrier at certain times of the year now. Otherwise, you have to wait until October, November, December. That is a new rule that's going into play, and it's going to affect people because before you would have had a special enrollment period every quarter, and years ago it used to be each month. So people that were enrolled into a dual eligible plan were marketed too heavily, and they could literally change their plan every stinking month. We had clients that would change 3 or 4 times a year, and it created all kinds of chaos. So anytime the government swings the pendulum, usually in that situation, and they swing it, they don't swing it to the middle of the road and give that person the eligibility to change based on, dual eligible population. Sometimes the medications are not covered. Sometimes the doctor is not covered. It comes out of network. And so anyways, creating complications. Now you either have an MCO alignment, and if your MCO is say Anthem in your state, and you want to enroll into an Anthem dual SNP or dual eligible plan, that's a Medicare-Medicaid plan with a Medicare Advantage carrier with Anthem. You can enroll in there one time, or you can wait to the annual enrollment period in November through December 7th, and you can make a plan selection effective for January 1st. Now, if you lose your dual eligible status, Medicaid, or you lose your low income subsidy, which helps on the federal level for medication, you actually qualify for a special election, and you'll be able to get with somebody and they can help guide you through. And we'd love to be able to explain that. If you've lost, here's another big factor with dual eligibility. It was suspended where they did not drop anybody for a couple of years during the COVID pandemic. And then all of a sudden the state started rolling out and dropping. And so in our state in Tennessee, there was hundreds of thousands of people losing their Medicaid. Some of those still qualified, and some of them didn't qualify prior because their income and assets were too high. They just kept them on there and suspended it out and kept them on there. Now they're dropping. So if you've dropped or lost your credible or that coverage as far as LIS or Medicaid, you may qualify. You need to verify if you qualify. And then I'm going to go into the last thing, what we call the MA pressure, which is very important. So what are some of the major things, the top 5 thing I want to be able to talk to you about the MA market, the Medicare Advantage or Medicare Advantage prescription drug plan options that are out there and some of the risk and pressures. One is we've seen more narrow networks. Some Medicare Advantage carriers have axed out doctors that would not keep to maybe a protocol of managing health for their patients. They've terminated those doctors off the network. We've seen hospital groups, hospitals lose contracts, negotiation contracts get terminated, and we've seen major hospitals in major areas. So typically I've always said that in metro areas, Medicare Advantage carriers are very stable with their networks when it comes to doctors, specialists, and hospitals, but you need to be aware of if there's major disruption. Now, I will say this, and we'll talk about this later on a different YouTube video and be watching for this. We're gonna be talking about it in 2027, there's projections stating that if your doctor is coming out of network with your Medicare Advantage or the hospital or specialist, you're actually gonna have a special enrollment period that Medicare may institute starting in 2027. But from now until then, you need to make sure you're verifying whether or not your doctors, your specialists are still in network, and if the hospital of your choice that you want to access is still in network. So a couple other things is that the narrow network, fewer extras. So we're seeing suppression of dental, vision, and hearing. So be aware, make sure that whoever you're talking to, and we'd love to be able to talk to you, is going through the summary of benefits correctly, and you're looking at the summary of benefits in the sense of understanding, it went from $2,000 dental allowance down to $1,000. Some benefits have dropped in half. Some have been eliminated altogether. Over-the-counter benefits have been suppressed on many plans. You just need to realize. And then some of the other things that have happened, there's more prior authorizations for certain surgeries. So there's been a huge amount of fraud, waste, and abuse that's occurred in original Medicare. And then in the Medicare Advantage world, some plans empower basically the physician to make the decision, and the plan will authorize a surgery and things like that. And then some plans are tightening up their prior authorization, which is not a big deal if you understand what I call the golden handcuffs. What are the steps? What do I have to do? If the doctor has to confirm with the plan that you need a surgery done, and then you have to do something in that process, or the doctor just does that, you just need to understand there's prior authorizations. If you've ever had major medical has it already. Medicare Advantage plans have that. You need to know that. You need to be educated that you know exactly what's going to happen before they just issue you to go have a hip surgery. They may say, hey, timeout. PT first for 12 visits, and then if that doesn't work, we're going to approve the hip surgery. So the doctor sometimes will still bend and break when it comes to fraud, waste, and abuse. And Medicare Advantage carriers are just there to be able to say, time out, let's make sure this person can't go through rehab or therapy first and then get the care that they want. Guys, it is a great pleasure to be able to talk to you. We are here to be able to walk you through and simplify Medicare. As we like to say, we want to make your life easy by making Medicare simple. I know you may have questions regarding this video and some content here. If you are unsure of what is going on in 2026 for your situation, call, schedule a time. We'd love to be able to educate you and walk you through. You're going to have plenty of time in the beginning of the year to make some plan selections depending on the plan that you're on right now, or we'll schedule a time for you in the fall of the year and love to be able to educate and inform you, and also just be able to have the opportunity to talk and make sure that you're on the right plan. Until next time, guys, I'll see you on the other side.